I'm Linda Elsegood, founder of the LDN Research Trust. It has been my honour to interview LDN researchers, prescribers, pharmacists and patients from around the world for many conditions. Thank you for joining us.
This afternoon I'm joined by rheumatologist Scott Zashin, and he's from Dallas in Texas. Thank you for joining me, Scott.
Thank you for asking me to speak with you this morning.
Thank you. So tell us, when did you first hear about LDN?
Well, I've heard about it for the first time through a patient who asked me to prescribe it. Mm-hmm. And this was probably in the last 2 years. And I've made it a point in my practice to listen to patients to find out things that they're interested in that might help them or things they're taking. I try to keep an open mind and not be closed off to alternative treatments that may not have gone through the rigorous FDA approval process, because I've found over the years that there's a lot of types of treatments out there that may be helpful for patients. In this case, a patient had come to me asking me to prescribe it for them for their fibromyalgia. I read up on it as much as I could. Your book wasn't available at the time, or I would have read that also. And I felt that the benefits of trying the low-dose naltrexone outweighed any potential risks from the medication, and so we went ahead and prescribed it, and the patient did get some beneficial effects from it.
Mm-hmm. So in the approximate 2 years of prescribing LDN, what conditions have you prescribed it for so far?
I've limited it mostly to fibromyalgia, because when I reviewed the scientific literature, I found most of the data for my specialty for fibromyalgia. On the other hand, I have read some anecdotal reports on other conditions, so I've recently put a patient on it with lupus, not as a sole treatment, but in combination with traditional therapy, and the patient had not adequately responded to the mainstream treatment for lupus, and we're looking for other options, and he was open to it, and I actually plan to see him back this week. But I am told through my staff that he has gotten a beneficial response in terms of his sleep and pain and would like to remain on the treatment. So I'm looking forward to seeing him back. Mm-hmm. I have also had an interest in seeing how it works for osteoarthritis. I don't have a lot of patients who I've prescribed it for osteoarthritis, and one patient I did prescribe it for had some issues with his sleep, so I can't really say that I have any data or information to report. But I think it could be a very big area if it is successful, as treatment for osteoarthritis is very limited. We have analgesics, things like Tylenol, non-steroidals, things such as over-the-counter ibuprofen or higher strength as prescription, some natural treatments. But unfortunately, other than going to narcotic pain medicines, we don't really have any treatments for patients who might not be able to tolerate the non-steroidals or get benefit. So if the naltrexone turns out to be an effective therapy, it could be a very big win for patients who deal with the most common type of arthritis, which is osteoarthritis. Mm-hmm.
And I can see by your list on your website, and I've interviewed people with ankylosing spondylitis, sciatic arthritis, rheumatoid arthritis, sarcoidoma, Sjogren's syndrome, and one lady had vasculitis. So it would be wonderful to have a rheumatologist on board who would then be able to persuade fellow rheumatologists to prescribe LDN. But I would like to say there are many doctors who find that their patients can't sleep very well when they first start LDN, and they actually change it to morning dosing so that sleep then isn't an issue.
Yes, and I read in your book that in England you actually prescribe LDN in the morning and not in the evening. So this is a treatment in evolution. As I prescribe the medication for patients and continue to read up on other people's experiences, I do change the way I prescribe it. For example, initially I prescribed 1.5 milligrams weekly in the evening and worked up very quickly to 4.5 milligrams over a 3-week period. Well, since I found some people don't tolerate it very well, I've changed my prescribing pattern where now I prescribe 0.5 milligrams in the morning and then gradually work that up over a couple-month period instead of as quickly. And I'm hopeful that by doing so, patients will tolerate it better, have more patience for the medication, and in the long run get better results. I'm also looking forward to trying it in other conditions if the patients are open to alternative treatments, such as Sjogren's syndrome, which again is one of those conditions where we really don't have any FDA-approved medication to treat it. Fatigue is a very common symptom of Sjogren's syndrome. In fact, over 90% of patients will often complain of fatigue. So if we could find an effective treatment to help them with their fatigue, that would also be a very big positive step in the treatment of patients with Sjogren's. So I'm, again, looking forward to offering to some of those patients. With rheumatoid arthritis, there are a lot of good medications on the market, and with rheumatoid arthritis, early diagnosis and treatment can help prevent damage to the joints. So in that situation, unless they have mild disease, I tend to favor the more traditional treatment, which has been shown to slow down and prevent damage, because I'm concerned if I delay with alternative therapies that I might miss the window of opportunity to prevent damage. On the other hand, a lot of people with rheumatoid arthritis have secondary osteoarthritis or secondary fibromyalgia, and in those patients whose rheumatoid arthritis is controlled, but they're still having symptoms, possibly from one of those other two conditions, naltrexone certainly could play a role in their therapy.
And as we were saying before we started the interview, that you would be open to telephone consultations for patients in Texas. How would they go about contacting you?
Well, they would call my office and speak with my appointment person or my office manager, 214-363-2812, and they can discuss what their needs are, whether they want to be seen or they want a phone conversation or review of records, and we can see if it's something that might be able to work out. Unfortunately, as far as I know, at this time, they have to be in Texas because I'm licensed in Texas. Whether or not down the road that could expand to other states is a possibility that I would have to look into.
Okay. And from the patients that have tried LDN, had they noticed any introductory side effects apart from the sleep issues?
So I prescribed it in a young woman and a woman kind of middle-aged. It seemed to rev them up a little bit, where they got a little bit hyper or wired, stimulated, which, in addition to sleep issues, affected their how they felt. Because from what I read, it does cross the blood-brain barrier, so there is some stimulation in the brain there, and so it may have caused that effect. Whether or not staying on it longer would have mitigated that effect, I don't know. In the first patient, she had been on it a while, stayed with it, but was actually not improving. So the other patient did have some intolerance to a number of medications. In the third patient, who was very sensitive to medicines, I actually, when I just saw her last week, prescribed a very, very low dose of 0.1, which almost a homeopathic dose to see if she might tolerate it and then work up from there. And I'm not sure how she'll respond to that.
We have found exactly that. People with fibromyalgia or chronic fatigue tend to be a group of patients that are ultra-sensitive to any medications, LDN included. And exactly as you were saying, by starting very low and then increasing the dose over time. Normally, everybody manages to tolerate it. They don't have any side effects at all. But most doctors who I've interviewed have said that they have found it's taken 4 months before their patients notice anything. So from a survey we did, we noticed that some people can stabilise, but they don't actually get symptom relief until they've been on LDN 15 to 18 months. So, if there is no reason why they shouldn't be taking it for longer, we would say to take it 18 months before you said it's definitely not working for me.
Okay, well that's a good point. I had a question for you, if I could ask you that. When I read your book, there was some thing written about the use of LDN in people on immunosuppressive treatment. In one of the chapters, that there was a question whether it should be avoided or maybe it's fine now. What have you learned with that? Because a lot of patients with lupus or even rheumatoid arthritis are on immunosuppressants, but they might benefit from LDN.
Yes. We have a fantastic new website. I'm not trying to cop out here, but all medications are different, and I'm not medically qualified. So on the new website, which is www.ldnresearchtrust.org, and at the bottom there is a form which says, I'm just scrolling down, ask about LDN, ask your medical questions, and they will be answered by either a technician, pharmacist, doctor, nurse, whoever is appropriate to answer the question. Okay. So obviously this one would be a doctor. So any questions that anybody has got regarding medication and whether they could take LDN, if they fill the form in and with their email, they will receive an email back from a qualified person, which I'm not, to say which medications can and cannot be taken with LDN. Is that helpful?
Yes, and I actually saw the website. It came through my email yesterday and looks quite nice.
Thank you. I'm very pleased with it. I was pleased with the old one, but after 3 years it was looking a bit tired. So we've got a facelift.
Well, you did a good job. I also one of my patients who came in was a doctor's wife. I had a long-standing history of fibromyalgia, possible mild lupus, and we went pretty much through everything. And then I suggested LDN to her, and she came back to see me after a month on the medicine, felt like a new woman. And she was very excited because she had been in the medical field and worked with a researcher who actually studied the toll-like receptors. And so she was quite excited when she saw how LDN works and how it involves the toll receptors. So that was a very good interaction. That it not only helped her, but she understood some of the mechanism.
Oh, brilliant. Yeah, I mean, there are so many people that have found with pain that LDN has been very, very beneficial. I've interviewed 3 pain specialists now, and Dr. Pradeep Chopra is one of our medical advisors, and he's been speaking at our conferences, and he is so in favour of LDN and what it has done for his patients that have been through every treatment that's been available, and their pain is still a 9 or a 10 daily, a pain level where they feel they've got no quality of life, and how he weans them off their medications and put them on LDN, and suddenly something so small can actually help with pain that is so unbearable. He was saying that the results can be as much as the pain has gone altogether, or the pain is still there, but it's at a level that is bearable.
Yes, and that's really what we're looking for. It's not necessarily they have to be pain-free, but to achieve a level where the pain is not interfering with the quality of their life like it does for many patients. And you also mentioned being one of the first rheumatologists that you spoke with to use LDN in their practice. I actually am a clinical professor at the medical school here in Dallas, and they've asked me to speak on alternative therapies. So I'm looking forward to including some information on LDN when I give my lecture to the medical students and house staff over there in the coming year.
Oh, wonderful. Well, maybe in a year or two, when you've got more experience of LDN, we can do a follow-up interview.
Well, I'll look forward to that. I'm planning to keep track of all the patients that I start in the therapy, so I can use that information to not only help me, but also help other doctors and give more information to patients on how these people are doing on the treatment.
I wonder as well, we have an LDN app, which is a tracker app, and we are trying to get doctors to use it in as much as getting their patients to use it before they start LDN, while they're taking LDN over like a year period. And we have a researcher, Jill Brooke, who is hoping to get a paper published. All the data is anonymous. It will just be case study 1, 2, and so on. But it works on your iPhone, your Mac, your Android, your PC, whatever, and they're synchronized as well. So if you use one device, it's automatically uploaded on the other, and it's free to use. And that would be a very useful tool if I gave you the link, if you wouldn't mind asking your patients if they would like to take part. So it's taking part in the world's largest, LDN survey. So
that's
that would
terrific.
Be very
I think
good.
they would be very interested in that, and you can let me know how to get that app, and I will pass it on.
Yes, definitely. Thank you. Also, if you would like to speak to any of the pain specialists, I'd be more than happy to introduce you to them.
Well, thank you.
And thank you very much for sharing your experience with us.
Well, I want to thank you for everything you've done and providing the world with so much information about this relatively unknown, but very useful treatment to help patients with their medical conditions.
Thank you.
So have a good evening.
Do you have LDN experience to share? If so, please email me, linda@ldnrt.org. I look forward to hearing from you.